why is functional medicine a better option for treating ADHD than traditional allopathic medicine?
I think the treatment of ADHD has pretty much changed over the last 100 years, every 10 or 20 years, based on how we describe the disorder. You know, for years we thought it was brain damage, and then minimal brain damage, and then hyperactivity with or without attention. So we keep changing the name, and treatment changed, but the treatment model in traditional psychiatry has always been symptomatic-based care, right? We have medicines to contain the symptoms, and a functional medicine model looks at the underlying cause. And I believe that is really the only way to treat ADHD.
And when you say underlying cause, what does that mean exactly?
Well, good question, because I think people throw that term out a lot without really understanding it. And I think the most important thing we can start with is that ADHD is likely a genetic disorder. It is a neurobiological disorder. The neurochemistry is different. The brain structure and genetics are different. And so we need to respect that. But there are many environmental factors that can contribute to some of the symptoms. And a functional medicine approach looks to determine as many underlying nutritional or biological factors to treat ADHD. Sometimes we find 1, 2, 10, sometimes we don't find anything. And I'm not opposed to medication, that symptomatic Band-Aid, if you will. But first, our approach is always looking at a functional medicine model, looking at the underlying cause. So it's not a behavior problem. It's not a, I don't want to pay attention problem. It is my brain can't pay attention problem. And that's why we need to address it biologically, because I believe it is a neurobiological problem.
There's so many aspects to it. And that's my personal issue with the allopathic approach, which is it's very like symptom, drug, symptom, drug, symptom, drug. And what I like about functional medicine is it addresses these multifactorial factors that come into what causes this thing of ADHD. And maybe for a lot of people who address themselves as having ADHD or have been prescribed ADHD medication or have been diagnosed with ADHD might not have the actual disorder of ADHD, rather more like symptoms like ADHD, but we're still treating everybody the same.
Absolutely. I mean, I think anybody that's not paying attention, either parents or kids or doctors, will just use terms like ADHD. I work with patients with eating disorders that malnourished, starving, and they can't pay attention because they're malnourished. And people would give them medications and call it ADHD. So